Good evening and welcome to week 15 of our Game Ready series. My name is Dr. Summer Ott. I'm an associate professor within the Department of Orthopedic Surgery at McGovern Medical School in Houston, and I'm the director of the Concussion program in affiliation with Memorial Hermann. I'm pleased to present tonight on concussion, more specifically what influences recovery time following concussion. In terms of financial disclosures, I have nothing relevant to this presentation. However, I do serve on committees and boards that also will not have an effect in terms of the presentation content for tonight's talk. I serve on USA Cheers Medical Advisory Committee, and I am the chairperson of a committee for the Sports Neuropsych Society. Concussion has been in the news quite readily over the past few years. It's received tremendous attention. The occurrence of injury provokes more debate than any other sport-related injury combined. Much of the attention so far has been on high-profile athletes who've sustained multiple concussions or have had some long-term consequences. However, compared to elite athletes, children may be at risk for longer recovery periods and long-term neurological and neurocognitive problems. The published data so far, even though there's many studies focused around concussion, the incidence, diagnosis, and recovery time, there's nothing that has really focused on or been efficacious in terms of or an agreed upon consensus when it comes to treatment. In terms of the acute signs and symptoms, signs are things that you observe in an individual who suffered a concussion, and they can include any of the following: appearing dazed, forgetting or being confused about a play, moving clumsily, having personality changes, forgetting information before or after the concussive event, having a loss of consciousness, although rare. The symptoms are the things that individuals report to their parents or caregivers, coaches, teachers, etc. And those things could be headache, nausea, balance issues, dizziness, light or noise sensitivity, feeling foggy, having sleep disruption, and cognitive changes. Some individuals have many of these symptoms and some have one or two. In terms of management and treatment, like I alluded to before, there is no FDA-approved medical treatment for concussion. An individualized treatment plan is recommended. Because individuals manifest so many different symptoms or have so many different difficulties, and they vary from one person to the next, you have to really tailor the concussion management plan to the individual themselves. A variety of treatments may be employed for persistent symptoms. Most recovery processes, though, happen within 10 to 14 days in adult athletes, and while in children it can be greater than 1 month. This is contradictory to previous literature that used to indicate that often suggested that people recovered within 7 to 10 days of their concussive injury. And certainly we advocate for an interdisciplinary approach to management. That means that we have several individuals that are dealing with different aspects of the injury. For example, I'm a sports neuropsychologist, so I focus many times on the cognitive changes post-concussion, the personality or emotional issues that might accompany the injury, helping someone get back into work and to play, and advising other clearing physicians who are writing for the person to return to sport, whether or not it's appropriate. Whereas physicians may handle the medical management, any physical therapy orders or prescriptions for that, or any diagnostic tests that need to be performed. We also work closely with physical therapists who participate in physical treatment for the athlete or the patient. And that may include vestibular therapy, which would be balance therapy or ocular motor types of sessions. And they may also address things related to cervical issues that accompany the concussion. And of course, we don't want to forget the parents, as well as school officials, coaches, athletic trainers are all vital in helping out with concussion management and helping the athlete or individual get back to their normal pre-injury level of functioning. Rest has always been paramount when it comes to concussion recovery. It's a non-medical treatment, and it certainly can reduce the risk of a second impact or another injury should someone return to sport or to activity too soon before the brain is fully healed. It's the most widely used intervention, and some recent research in 2016 indicated that athletes who remain in the game or continue to play and do not remove themselves or report the incident to a higher authority often have twice as long of a recovery as compared to those athletes who the concussion was early identified and they were removed from sport immediately. There's certainly the opportunity to ease back into your activities, which is recommended. We don't want complete shutdown of things, and I'll get into that, but being able to slowly, gradually progress someone back into activity is the best medicine. There is limited empirical support to support that physical and cognitive rest completely negates the concussion, or that it helps tremendously slow the recovery, although individuals that report that they did take time off, maybe from high cognitively demanding jobs, or they were able to rest within at least the first 24 to 48 hours, had a better outcome. We no longer advocate for what we call cocoon therapy. And what this means is where someone goes into their room, they lock themselves up in the room, they shut down all the blinds, they turn the lights down, and they basically hover in their bed with the sheets pulled over their head. We do not advocate for this, although many times if you happen to Google or see what should be done for concussive symptoms, this is sometimes still indicated, and we advocate not to do that. However, and the reason for it is because it really can promote like anxiety for the person. It doesn't allow them to kind of be exposed to the environment, so it shuts them off. So then when they do re-engage with things, it can be even more difficult. So we advocate for, yes, rest, but get out of your room, walk around, do some things that are tolerable with the guidance of your physician or concussion specialist. So what are the risk factors for prolonged recovery? There are several that have been identified through research. In the first top of this slide, you'll see that there are several listed that have multiple studies to support that they are factors or influencing things in terms of recovery. One of which is gender. Another, age. Individuals that suffer from multiple concussions may have difficulties. We also look at individuals in terms of their pre-injury migraine history, as well as do they have headaches after. Psychological functioning, pre and post injury, and then any history of pre-existing learning disability or ADHD. The following or the subsequent items on the list there: improper management, socioeconomic status, race, ethnicity, and genetics have also been identified as potential contributing factors to recovery, although there's not as much research to support those aspects at this time. And I'll get into each one of those factors more specifically in our subsequent slides. So let's talk about sex differences in concussion outcome and injury rates. Certainly increased exposure is one of the aspects that we think about. Many more males play sports than females. However, in sports where there are individuals, both male and female, that play that sport, like basketball, hockey, soccer, women tend to suffer concussions at a higher rate, and the recovery processes do take longer. And some of the reasons for that, or the theoretical basis behind some of those things, may be head, neck, mass stability. So women often have skinnier necks, and they don't have as much control as men do. So we often work with girls about strengthening their neck muscles and working on that cervical and postural stability. Cervical strength goes along with that as being maybe weaker in women than there are in men. Improper technique. Many times, and I've talked to coaches about this who coach both males and females, and they'll say, you know, we do kind of bias towards males in that we spend more time working with them on technique and maybe not do so much of that with female athletes. So that could play a role in that improper technique is contributing. Another aspect may be protective equipment. There are some sports, for example, like lacrosse, who don't always enforce helmets. So in female athletes, and of course a lot of females play non-contact sports like cheer. They also may participate in soccer, and those are also sports where helmets aren't mandatory or any kind of protective headgear. They're sometimes suggested, but they're not mandatory, and therefore girls often do not wear them, whereas in other sports that males tend to play more often, like football, it is a helmeted sport. So what are some sex differences also in functioning and recovery? In terms of neurocognitive abilities post-concussion, females are 1.7 times more cognitively impaired than males on testing, and they perform worse than their male counterparts on visual memory tasks in particular, although women do tend to be a little bit weaker on visual memory tasks when compared to males prior to concussion. So many times concussions just sort of make things or increase our weaknesses or make them more apparent after an injury. Often women exhibit slower reaction time when compared to their male counterparts. But there are some research, just to throw it out there and make it a bit more complicated, there is some research to support there are no differences neurocognitively post-concussion. When we talk about emotional functioning post-concussion, coping response amongst high school and collegiate athletes, females tend to report more post-injury psychiatric symptoms and so forth when looking at a pediatric population compared to their male counterparts. And then when we talk about recovery, females had longer recovery course, and they often required more treatment interventions beyond just standard cognitive and physical rest. So what might play a role in some of these things? The American culture may be more supportive of women who acknowledge pain. So for example, if you have a male and female and the woman complains about pain symptoms, they may be more accepted than if a male did so. And survey research suggests that males often take more risks than females, and women tend to socialize and express their emotions and seek social support and maybe ask for things, maybe report it to their parents and teachers and coaches more so than their male counterparts. Men are certainly in our culture taught to tough it out and to play through pain. And perhaps women are more concerned with their future physical health. When it comes to education, however, females did seem to have less education when it came to concussion than males, which is interesting. So maybe perhaps, women are reporting things more often, but when it comes to really understanding concussion, women may not have as much information. And a lot of the concussion educational talks often seem to focus on football and other sports where males play that more often. So another factor in terms of what could make recovery longer in females is with respect to hormones. We talked about neck strength as being a moderating factor, but also hormones. There's been some research to support that progesterone is something that is affecting concussion in one way or another. So females in the luteal phase of their menstrual cycle, which is the high progesterone phase, often have worse outcomes compared to the follicular phase, is where the progesterone is lower. And that was one study that supported that. We are also collecting or finishing up our data collection and analyzation of data here at UT Health, where we've been looking at female adolescent athletes post-concussion and looking at different inflammation markers as well as their hormone markers. And we too are finding that progesterone is playing a role in longer recovery. Oxytocin is often distributed in higher stressful situations, and so forth. That also may play a role in how females respond to concussion recovery and to pain. So we've talked about gender. Let's talk about age. So there is some research. There's actually several studies to support that the younger you are, the longer it may take you to recover from concussion. And so that's interesting. So for example, in a study that compared high school athletes to collegiate athletes tended to have a quicker neurocognitive recovery and also lower symptoms after a concussion. And this also held true, a similar trend, when comparing high school athletes to NFL players. The NFL players often had some symptom resolution within 3 days of their injury, whereas high school athletes were taking upwards of a week or more. Some reasons for that may be, again, the developing brain. Oftentimes our frontal lobes in our brain aren't fully developed until after age 18. It may also be that players that get to the professional level are often more fit. We see that orthopedically. They tend to recover from their injuries more quickly than younger athletes as well. There's really been few studies, though, looking at our really little kiddos. So kiddos that are below the age of 10 in their recovery course. There's more research that needs to be conducted there. But oftentimes when compared to, again, the adolescent athlete and then the higher level athlete, that may be the difference. And I often get asked that, well, how come so-and-so professional athlete got to go back after a week and here I am at 2 and 3 weeks and I'm still recovering from my concussion? And that may be the reason, is an age effect. So again, I want to reiterate that in adult athletes, recent research has supported that it's greater than 14 days for their concussive symptoms to resolve, and in children it can be greater than 4 weeks. So parents that come in and they're still having a child that's suffering from concussive symptoms at a week or 2 weeks, don't panic. It's actually pretty common. Previous concussions also play a role in concussion recovery. So we look at the time interval between the concussion and the symptom duration. And so recent or multiple concussions are certainly at risk for higher or longer recovery patterns. So for example, if you've suffered a recent concussion, maybe a month prior to having another concussion, or you've had a history of 3 and 4 concussions, you're certainly going to be at risk of suffering another injury. Athletes with previous concussion history also have have more significant on-field markers and severe symptoms following a concussion. So for example, if you've had several concussions before and you sustain another one, the likelihood of you losing consciousness or having bigger degrees of amnesia following the event are higher than if you never had a concussion before. There are subtle yet prolonged neuropsychological deficits found in youth athletes with 2 or more previous concussions. So even though they may have reached symptom resolution, there still could be a neurocognitive effect if you've had previous concussions. A past sports-related concussion is also a risk factor for having future sports-related concussions, as I mentioned already, and having multiple sport-related concussions associated with having more physical, emotional, and cognitive symptoms before participation in the next sporting season. So take, for example, you've had multiple concussions. Your school asks you to participate in their baseline testing program, which is a pre-injury assessment generally of cognitive functioning, often balance assessment, and so forth. On that symptom checklist, you may be more prone to mark more symptoms than someone who hasn't had a concussion, and also having more neurocognitive difficulties. Let's discuss pre- and post-injury migraines. Migraines or headaches after concussion tends to be the most persisting symptom. In my experience, most of the time when the headache abates, a lot of the other symptoms follow suit. It's also correlated with increased symptoms and lower cognitive performance at baseline. So if you're a migraine sufferer before you've ever had any concussions or tend to have a frequency of significant frequency of headaches, you are also going to be more inclined to have more symptoms at your baseline when you do that baseline study, and you may have lower neurocognitive scores compared to other individuals who do not have a migraine history. The effect seems to be more prevalent in females than in males. So certainly females after concussion, although they're more prone to migraines even before concussive injury, may also have that barrier afterward where the headaches are pretty significant. And family history has also been deemed to play a role as well. So if there's a family history of headache, particularly in the mother, many times there's a hereditary disposition or predisposition for the child. So therefore they may have acquired a migraine disorder anyway. And I've found, and many other researchers have alluded to that concussion may speed up that process of having migraines when a concussion occurs. The concussion may speed that up. Pre-injury neuropsychological or psychological functioning certainly cannot be overlooked, but I think many times it is. There are individual differences in stress response. The inability to cope with stress or an adverse event can play a significant role if you have a concussion, because it does disrupt your daily life. It's self-limiting. It affects the family unit. And there's also been personality characteristics that have been identified in those individuals who do tend to have a longer recovery course following concussion. So all is not lost here. If you fall into any of these personality categories, it's okay. I think it's just important to note that if you're an overachiever, you're somebody that doesn't take a break, you are type A, you like to have everything in your control, concussion will be a very challenging situation for you. So I like to get to know my patients, and if they fit within any of these categories, I'm very upfront with them and say, look, you are very successful, you're perfectionistic, you do all these things. However, you have to rest following a concussion, and you have to let your guard down a little bit. You need to relinquish control, give yourself grace. And so having that pep talk with people does help, because they're thinking, what's wrong with me? Everything that I've done in my life in terms of being somebody that works super hard is actually making my symptoms worse following a concussion. So it's important to know what someone's personality features are like as well, and determining if that's going to play a role in their recovery process. Individuals that are dependent, maybe insecure, they're very grandiose. If they have a lot of reactive types of things before the concussion, you might notice that they are very reactive also after the concussion. Post-injury psychological functioning is different. So we talked about pre-injury. That's what you bring to the table. Many people neglect how their psychological functioning was before. They don't want to think about it. They think the concussions caused all these problems for them. But if we really step back and we say, okay, or the person was experiencing some anxiety and depression beforehand, that may be magnified with a concussion. But there are also post-injury psychological consequences, emotional-wise, for athletes and individuals who maybe never had any kind of disorder psychologically before. Some of those changes could be depressive in nature. It can increase anxiety. If they've had a very traumatic accident, like a car accident or some kind of assault, there certainly can be post-traumatic stress symptoms or acute stress symptoms involved. And some people often experience panic attacks too post-concussion because they're just nervous or symptoms are always heightened. So some of the post-injury contributing factors to having emotional manifestations following concussion are physiological. So when the brain is concussed, there are often neurochemical changes as well as areas that are affected, particularly if there's a frontal head blow, which we do have people come in and they will have been hit in the head with a baseball in the front. And that can produce personality changes. Maybe they're defiant, they're not compliant, they're saying things out of turn. Those things can happen because that area of the brain was affected. Loss of scholarship. Certainly athletes are very nervous if they're at the collegiate level and they're going to lose their scholarship because they can't play. Time away from sport or team. They may fear losing their position. They may feel very isolated because they're not around the team all the time. They're worried about academic demands. Those don't just shut off. They're still responsible for things. So that is hard when you don't feel well. Vitamin deficiencies. We found in a number of concussed athletes, whether it happened before or after the concussion, they've had vitamin deficiencies that play a role in emotional functioning. So it's always important to kind of entertain that as an aspect. And then identity crisis for the athlete or the individual who assumes a certain identity is the role of, I'm the mom that does everything. I go everywhere. I take everyone to everything. I help kids with homework. Or you're the athlete who has played sports since you were 3 years old and now those particular roles and responsibilities have shifted or been taken away as you recover. That can be really difficult to deal with. So it's important for parents, providers, siblings, anyone that, to be very mindful of the person that you're with and that had a concussion. If they're exhibiting any of these things, that could be some of the reasons why. So let's also discuss now pre-injury ADHD and learning disability. Those with ADHD and learning disabilities, so talking about things like dyslexia or reading or math disabilities, ADHD could be both inattentive and hyperactive, may require more careful planning after a concussion. So many times those individuals receive academic accommodations before an injury happens, and they need to be supplemented even more so after an injury occurs. These developmental conditions have been known or associated with a greater prevalence of prior concussion, and it's believed that perhaps individuals, particularly with ADHD, often take more risks. They're more impulsive and therefore put themselves in harm's way, might be risky and very active on the sport playing field. Perhaps individuals with a learning disability have often forgot things or they're not mindful of their environment that have caused accidents as well. Those individuals often report at baseline, even prior to suffering a concussion, a lot of concussion-related symptoms. So it's important to tease apart at the baselines, which is the pre-injury participation. Is this person having any concussive symptoms? Because they can often overlap. And so a good, careful conversation with the athlete or the individual about their symptoms is important. And college students with ADHD had more severe symptoms in the first 2 weeks of their concussion if they were or did have a history of ADHD or learning disability. So you may expect in these individuals who have this prior history that their symptoms will be more magnified following concussion. What are other risk factors? So these are things that haven't been as well researched, but they're certainly things to consider. And this is one aspect, is the symptom severity score at the time of injury has been, in at least a few studies, the most predictive indicator of symptom course. So if you have somebody that has marked on a symptom checklist nearly every symptom, there's usually about 22 common concussion symptoms, and they're rating them on a scale of 0 to 6, with 6 being the worst they can imagine, and they're rating 4s and 5s, it's probably going to take them a while in terms of their symptom resolution. Not always, but more often than not. Improper management. I can't stress enough that athletes have to take rest, withdraw from sport, protect your brain, protect your future livelihood. I always say to athletes that give me a few days to help you recover and get better rather than, going back, rushing back, and then jeopardizing your season and, more importantly, your life. So as we mentioned before, the research by Elbin and Associates did indicate that athletes that continued to play following a concussion were 8.8 times more likely to demonstrate a protracted recovery than those that were removed from play. So if you're out there questioning, oh, I just have a small bout of dizziness, or my vision went weird for a while, but it seems like it's getting better, the headache's not too bad, you're setting yourself up for a disaster. You need to come off the field, as hard as that is. Completely understand how difficult that is and the burden that's on your shoulders as an athlete to continue playing, but you will risk many things in doing so. It's that whole add insult to injury discussion. So what about race and ethnicity? My colleague, Dr. Agarwal in the School of Nursing, we looked at our data and we found that students that have private insurance as opposed to those that had public insurance or school insurance often had longer recovery times. We also found that minorities had fewer recovery days than whites. Now, perhaps there's more of an emphasis for some individuals to continue playing because that's their only means to a scholarship or means to a better financial future, whereas individuals that maybe have more wealth do not place that particular emphasis on sport participation. This is just merely a hypothesis. The other thing is that perhaps athletes with public insurance don't have as many resources at their disposal and as many specialists at their disposal in terms of recovery processes, therefore not identifying perhaps that their concussion is as serious as it is. Genetics. When we think about ApoE, which is a genetic disposition, it is something that we look at in terms of Alzheimer's, dementia, and other neurocognitive disorders. And it is something that is the most studied gene when it comes to concussion as well. Researchers believe that perhaps this is affected in terms of also playing a role in those who maybe have long-term consequences from concussion and those who don't, or those that take longer to recover as compared to those who have a pretty expeditious recovery. So those are some things that are being looked at still in the research that are not as highly validated as some of the other topics that we talked about before. So just some tips for managing acute concussion. If you do it right, this can really make all the difference. Sleep disturbance is fairly common following concussion, so really recommend that you eliminate distractions when trying to rest. So many teenagers have their phone right beside them at their bedside table or in hand, maybe even sleep with it next to them. And that, especially if it's on, the brain is registering all those beeps and calls or tweet indicators or whatever is happening throughout the night, and that can be very disruptive for sleep. And certainly being on any kind of electronic device prior to bedtime can really make the brain hyperactive and could also prevent it from getting into the sleep mode. Minimizing daytime naps. Many athletes or individuals following concussion are very sleepy, so we do encourage a few naps, but sleeping all day can certainly dysregulate sleep at night, so getting back on track with that. Minimizing caffeine and avoiding alcohol. Alcohol is a vasodilator. It can make more inflammation in terms of brain function, and so that therefore you'd want to minimize. Melatonin can be helpful to for those individuals who are having some sleep problems. Over-the-counter medication to help them kind of initiate sleep and maintain sleep throughout the night. Some somatic symptoms, those are things like dizziness, headache. They can be light and noise sensitivity. Of course, I indicated earlier that headache is more common. Tylenol and ibuprofen, over-the-counter medications, can be helpful in the short term, although many times you will see notes from us and other providers that say, please do not start ibuprofen or any kind of anti-inflammatory until you've been cleared by a physician to do so. If there were to be the rare circumstance where you have a small bleed in your brain, that can certainly make the hemorrhage greater and run risk for that. Sunglasses to reduce light sensitivity. Blue light glasses can be very effective too. You can purchase those on Amazon fairly cheaply, and you can utilize those, especially if you're doing a lot of computer work post-injury. You can reduce your electronic device use. I encourage that as well. You don't have to completely take it away. So sorry, parents, if you're thinking you can have a device holiday for a whole week, probably not going to be effective. It's going to actually make the symptoms and the anxiety in your child worse, but you certainly want to reduce their screen time, and there's a way to do that in moderation too, with lots of breaks. Reducing screen brightness, increasing font on electronic devices is super key. In controlling activity, we say cognitive activity, we say take 15 minutes of doing something mental and take a 5 or 10 minute break, come back to it. That's the way we approach schoolwork and work in general, especially for those of you that are working from home and you've suffered a recent concussion. You want to set timers on your phones or your kitchen timer to do some activity for a certain period and then take a break. Emotional symptoms, coping strategies. It's important to do deep breathing, do visual imagery, have positive self-talk if there's any kinds of emotional responses to concussion. And I teach people those tasks in the first session or talk about them so that they can use them when they feel like my headache's coming on strong, now I'm getting anxious, and we work on things to help control those symptoms. Participation in team and social events is tolerated. I think taking someone completely out of all social things is a really bad thing to do. Certainly if they can't be in school for a day or two, have their friends call them, or maybe a friend can drop in for a few minutes. The social functioning is so important to help support the individual that suffered a concussion. And then compensatory strategies for cognitive issues. So many times individuals post-concussion complain of, I can't find the right words to say. I'm losing track of the conversation. I'm having problems with my memory. I'm misplacing things. So we talk about ways to help them remember things better, maybe focus on concentrating more on aspects, giving themselves, again, some grace. They may forget words. It's generally very temporary. It's okay. Breaks are going to be key to helping them focus on attention. Repeating things to people, not in a mean way, but repeating and say, hey, so what you said was, and then repeat back the information. That could help the person rehearse the information and store it better. So conclusions, we can't prevent all concussions. Certainly concussions happen in all sports. It's not just a football issue or hockey issue. It happens in all sports. We have plenty of examples here of concussions happening in golf or baseball or cheer. Tennis, any sport, it can happen. But most concussions, I would like to emphasize, especially in our young children, happen on playgrounds. They happen on riding bikes, and then wear your helmet. So those things also play a role or cause concussions. Early detection and management of the concussion is key. Again, identifying the signs and symptoms, seeing a specialist is ideal. Seeing someone that can walk you through every aspect of your concussion. Consider and examine how the concussed patient's pre-injury history played a role in or could be playing a role in their recovery process. So what you bring to the table in terms of, before your concussion happened, maybe things that if you struggled with something before, like you were a headache sufferer, you tend to be more of an anxious person. The concussion likes to make that bigger and bring it to the surface. So it's important to know that can happen, and we can certainly cope with that and deal with it. An interdisciplinary team is vital to concussion management. It's not just me managing the concussions. I'm lucky to have a whole team of people, and there's a better outcome when individuals have that. There are several programs where they offer that type of service. So, you're a young youth athlete, you the car accident victim, you the person that was assaulted, you can have a team approach like professional athletes do to managing your concussion, and that's here at our institution. You can work with a concussion specialist. You want to have someone who knows what you're going through, understands what the signs and symptoms are, all of the different variables that play a role in recovery. I always say you wouldn't go to a heart surgeon to treat your orthopedic injury, or you wouldn't use age-old technology for your ACL repair. So why would it be any different with concussion? You have to make sure that you have an individual that really knows what they're doing here. Keep in mind, most concussion patients do recover within 2 to 4 weeks. However, there are some patients that have persistent symptoms, and there are treatments and things, although maybe not FDA approved, that can certainly help reduce the symptomatology. I'm happy to answer any things in the chat, as I probably should have mentioned that earlier, but any questions that you have, and certainly you can get with our team if you have any questions or have an appointment or know someone that could benefit from our treatment here at UT Health in the Department of Orthopedic Surgery. Have a wonderful evening, and thanks for tuning in.